Hi everyone, this is Dr. Bolad, board certified physician in cardiology, interventional cardiology, and internal medicine. Today, I'll be talking to you about heart attacks, medically known as myocardial infarctions, and how they present and the diagnosis and treatment of heart attacks. The most important aspect in the treatment of patients with heart attacks is the immediate recognition of the heart attack, since the benefit of treatment and saving the muscle of the heart is greatest when the patient presents early after the symptoms start. Heart attacks are diagnosed by the specific symptoms that the patient experiences, in addition to the electrocardiogram obtained known as the ECG or EKG. In this video, I will summarize the current emergency treatment of patients presenting with heart attacks. What leads to a heart attack? There are certain risk factors that lead to the development of lipid collection in the inner wall of the arteries of the heart. These include smoking, high cholesterol level, high blood pressure, and family history of heart attacks, and others. The process is as follows. First, cholesterol deposits on the inner layer of the arteries of the heart, the coronary arteries. These lead then to an inflammatory reaction. Then a cap develops covering the deposits. With continued accumulation of the cholesterol material, or due to stress, the cap eventually breaks. This will lead to clot formation, which will block the flow of blood through the coronary arteries, leading to a heart attack. Here is an animation of what happens. The heart is responsible for pumping oxygen-rich blood to the rest of the body. The muscle of the heart itself also needs a supply of blood. We see one of the coronary arteries here. When a cholesterol plaque cap breaks, platelets attach to it, creating a blood clot, blocking blood flow to the muscle of the heart. Without blood, the heart muscle is starved of oxygen, causing damage to the heart muscle, and a heart attack occurs because the damaged muscle can no longer work properly. What are the symptoms of a heart attack? The symptoms of a heart attack, as shown in this image published by the American Heart Association, include sudden onset of chest pain or discomfort, lightheadedness, nausea or vomiting, jaw, neck or back pain, discomfort or pain in the arm or shoulders, and shortness of breath. What are the ECG findings of a heart attack? The ECG findings of an acute heart attack is represented by an increase in the ST segments in the ECG tracing, as shown on the tracing provided. This acute heart attack is labeled medically as ST elevation myocardial infarction, known for short as STEMI, and represents a sudden blockage in one of the main arteries of the heart. This type of heart attack is also known as type 1 heart attack. I will not dwell on the other types of heart attack in this video, and I will talk about them in another video. What are the initial steps in the management of a heart attack? When a patient gets one of the symptoms of the heart attack mentioned earlier, he or she should call their emergency number for help. On arrival of the emergency medical team, the patient is given oxygen and an ECG is immediately performed. If ST segment elevation is noted on the ECG, the patient is taken immediately to an emergency room in a hospital capable of treating heart attacks. General principles in the treatment of heart attacks. Once a patient is diagnosed as suffering from a heart attack with ST elevation on the ECG, known as STEMI, early treatment involves simultaneous achievement of several goals. giving the patient aspirin and other medications to limit the clotting ability of the blood, oxygen supplementation if the oxygen saturation is less than 90%, assessment of how the heart attack is affecting the blood pressure, relief of the chest pain by painkillers, including the use of morphine, activation of the cardiac catheterization laboratory to open the blocked coronary artery and restore normal blood flow to reduce the heart muscle damage and reduce the risk of death. The standard target of opening the blocked artery is less than 90 minutes after arrival to the hospital. What happens in the cardiac catheterization laboratory? In the cardiac catheterization laboratory, for short termed the cath lab, access to the arterial circulation is gained through the groin or the arm. A short tube is placed in the artery. Through this short tube, longer tubes called catheters are passed to the heart, and the tip of the catheter is placed at the origin of the coronary artery. A radio-opaque dye called contrast is injected, and this can be seen clearly using X-ray equipment. The coronary artery blockage is then located. Then we perform a procedure known as angioplasty. A guide wire is passed through the blockage, and through that wire a balloon is passed and inflated at the blockage to crush the plaque and the clot to restore blood flow to the muscle of the heart. Then the balloon is removed and a metal scaffolding known as coronary stent is passed to the blockage site and placed to prevent or reduce the risk of blockage forming again. In the current day and age, the stents are covered with a medication to prevent narrowing of the stents in the weeks and months to come. These stents are known as drug-eluting stents. Then the wire and tubes are removed from the body and the patient is transferred to the coronary care unit. What happens after the stent is placed? After the stenting procedure is done and the blockage is cleared, the patient is then admitted to the intensive care unit or the coronary care unit for observation of complications, either arising from the heart attack itself or arising from the cardiac catheterization procedure. The patient is given aspirin to take for life and another platelet blocking agent for a minimum of 12 months. The other agent can be either clopidogrel, ticagrelor, or prasugrel. The patient is also started on a cholesterol-lowering medication, generally of the statin group of medications. In addition, the patient is also started on a medication to slow the heart rate from the family of beta-blocker medications, as this has been shown to improve survival on the long term in patients with coronary artery disease. If there are no complications, the patient is discharged from the hospital in 2 days to go home, and arrangements are made for the patient to start cardiac rehabilitation. The patient is then seen in the outpatient clinic in 4 to 6 weeks for assessment to evaluate whether anything else needs to be done. All the above steps in the diagnosis and management of patients with a heart attack are aimed to minimize or even prevent any damage to the heart and to have a healthy and happy patient at the end of the process. If the patient presents early and is taken to the hospital immediately and taken to the lab within a very short period of time, the flow of blood to the heart muscle is restored and the patient should end up with no residual heart damage. Every single minute counts when you are suffering from a heart attack. This underscores the importance of recognizing the heart attack symptoms early and activating the emergency system immediately, and this should lead to the patient ending up with no heart damage at all.